Right now, health officials are scrambling to stop the measles outbreak from spreading even more after reaching what they call a critical point.
Today, 1,000 people in Arizona are being monitored for the virus. The state is now ordering people who were exposed and who haven't had the vaccine to quarantine themselves for 3 weeks. There are nearly 100 confirmed cases of measles in the U.S.
Most of them are in California and can be traced back to Disneyland. Now, Dr. Jon LaPook joins us now. Now, this outbreak, thanks for being here, really reminds us how serious this virus can be, right?
Right. I mean, people have forgotten about it because it hasn't been around. It's been obliterated in the United States since the year 2000, but that doesn't mean that it's gone. It just means that year-round it doesn't keep getting propagated. But there are these pockets of unvaccinated people, and what happens is somebody goes from abroad, comes here from abroad who is infected and infects somebody here, and it can cause severe illness. 1 in 3 people get a complication. 1 in 1,000 people die. Now, back years ago, before the vaccine, there were 3 to 4 million cases a year of measles in the United States. 500,000 of those were reported, and about 500 people died. So it can be very serious.
And what are some of the symptoms? How do you know that you might need to go see a doctor for this particular?
Well, you know, it can be viral type symptoms, so runny nose and sneezing and fever.
So you might not know.
You might not know, but then that rash, that telltale rash comes, and you probably have never seen it. I actually am old enough to have actually seen that rash, but not in any patient, because I was in medical school way after it was obliterated here, but in my sister Nancy. She had the measles. I still remember what that looks like. And here's the problem. You can be infectious before you get that rash.
You can.
So that's why, you know, we have this case in Arizona where there was a woman in an urgent care center. She potentially exposed 190 people. Why? She's sitting there in the emergency room. She feels perfectly fine. She goes home, and then she discovers that she was potentially infectious. And, you know, it's spread throughout the air. Highly, highly infectious. It is aerosolized, and it can even infect you a couple of hours after the person who's infected leaves the room. So it's a big deal infectious.
And it's spreading partly because of this anti-vaccination movement in the U.S. Is this outbreak actually causing some of those parents to bring their children in to be vaccinating? Is it helping the movement?
You know, anecdotally, I'm hearing that some people are finally saying, you know something, maybe it's time to get vaccinated. We don't have the numbers. I will tell you, in my very own internal medicine practice this week, there was a young woman in her 20s. She was not immune. I had tested her. She was negative for measles, mumps, rubella. Clearly, she had not been vaccinated. And she had been saying she didn't want to get it. And I said to her this week, "You're getting it." I said, "You're getting the vaccine." And I said, you know, obviously you can refuse it, and it's easy for me to just say, fine, I've warned the patient and they've left, but I really want you to get it, and especially if you're going to get pregnant someday. German measles, which is rubella, you know, can cause birth defects. So get it. So finally she acquiesced. She was afraid she was going to get fever. She was afraid she was going to get muscle aches and pains there. And finally we sort of got to it, and I said, "Is that really it?" And she said, "Well, it's probably just an irrational fear." She grew up in California. That was the sentiment she heard. She got the shot. I called her the next day. No problem whatsoever.
Do you think we've
Tales
seen...
from the front line.
Yeah, exactly.
From the front line.
Well, do you think, though, we've seen the peak of this?
We don't know that, because here's what happens. You have the initial outbreak. We saw that in Disneyland, right? Then there's an incubation period, which is anywhere from, you know, 1 to 3 weeks on average, 2 weeks. Then there's a second wave, and then there could be a third wave. So we don't know yet how many waves of this there are going to be.
Okay, Dr. Jon LaPook, thank you for sharing that important information with us.
Thanks, John.